Children's Hospital. Today I get to ask Dr. Drano everything about surgery for IBD patients. Why is surgery sometimes needed?
In general, one of the principles of management of inflammatory bowel disease is we try to do everything we can to avoid surgery. But sometimes it gets to the point where we feel that everything we've done with medicines or dietary therapy is sort of maximized, but the patient's still not getting better. We may need to move to surgery to try to treat whatever is going on with your inflammatory bowel disease. So again, we try to avoid it, but there does come a time where we feel that it is beneficial and can actually really help patients. The main general reason why we would need to do surgery in patients with inflammatory bowel disease would be if whatever we are treating them with, whether that be medicines or dietary therapy, is simply not working. When we get to that point, we don't want to see our patients continue to struggle, and if we feel that surgery is a good option for them, we will start to discuss it.
What are the biggest myths about surgery?
I think the biggest myth surrounding surgery in IBD patients is that most or even all patients are going to need surgery at some point. This is actually, fortunately, not true. Medicines and other treatments such as dietary therapy have really come a long way in the last 10 to 15 years to the point where most patients can be successfully managed without ever having surgery. The next myth, I think, would be that once you have one surgery, it means that you're going to need to have repeated surgeries throughout the years. And that's also fortunately not true. Most patients who need surgery only have to have one surgery. I think another very important myth would be that once you have surgery for inflammatory bowel disease, it means that it's completely cured and you never have to come back to the doctor and you never have to take any more medications. In fact, there's good research that shows that it's very important, especially in Crohn's disease, that you do continue taking some type of medication, and you definitely need close follow-up after that surgery occurs. And the team will work together, your doctor, dietitians, surgeons, and we'll all determine what we think is the best management for you, and we'll discuss it with you.
Who makes the decision if surgery is needed?
The decision to proceed to surgery is one that is made as a group, and that group is going to consist of certainly your pediatric GI doctor, but also our colleagues, the surgeons. We don't just call them and tell them what to do. We want their input, we want their opinion. So we talk about it as a team. Other people who you may not realize who are also very important in helping us determine when surgery would be necessary would be our radiologist and our pathologists. And certainly we have dietitians and social workers and nurses who are all part of our team, but the main people who are going to be involved are going to be the GI doctor and the surgeon, and of course you, the patient. You're always going to be involved in decision making. We're always going to tell you what we're thinking, and we're always going to give you options. We'll tell you what we think is the best option for you, but we always include you in the decision making and respect your wishes.
What does the recovery time typically look like?
Recovery time is going to depend on what type of surgery you have, and we can't get into all the specifics today. Every patient with inflammatory bowel disease has a different type of disease. Even though it may be called Crohn's disease or ulcerative colitis, everybody's different. And we really look at the whole case, and we look at the course that you've been through, and that's going to help determine what kind of surgery you have, and what kind of surgery you have is going to dictate what your recovery is. So basically, recovery can honestly be anywhere from 1 to 2 days to a couple weeks. I would say that in general, you're going to be out of the hospital in roughly about a week. It can be a little bit less than that, and it can be a little bit more than that.
What can a patient do to prevent surgery?
This is a very important question, Catherine, and I'm glad you asked this. Sometimes surgery is not avoidable. And despite everything that you've done, that the doctors have done, it comes to the point where you need surgery. However, the things that you can do to try to prevent getting to surgery would be making sure that you're going to your regularly scheduled appointments, making sure that you are bringing up issues that you're having at your visit. We don't want you to just tell us that you're doing fine if there's really something going on. So please just be open and honest with us. Let us know if something is not right or if you're not feeling right. Another major issue, especially when our patients get more independent as teenagers, is medication compliance. So taking your medications as they're prescribed is very, very important to try to maximize your treatment and to try to keep that disease under good control.